Hi guys! Welcome back to my channel Proactive Mom. My name is Lisa Elbas and today I'm going to discuss with you some important factors which you should carefully think about when choosing a pediatric therapy center for your kid. It is known fact that starting interventions early gives children an opportunity to learn and develop at their fullest potential. That's why if the pediatrician noticed that your baby or toddler was not meeting milestones and referred your kid to get evaluated at a therapy center, please do not panic. Physical, occupational, and speech therapies are considered standard therapies that will put your child on the path of developmental success. I was told that my son would need some extra help and therapies on the day that he was born, as premature babies usually develop slower. Back in time, I had no idea what to do, where to start. Just grabbed a list of the names of the different centers from the pediatrician office and started to call them one by one. Luckily, I found one center that had availability right away and was located very close to my home. The therapist there was very knowledgeable and experienced lady who was great fit for my son and always welcomed my curiosity and tons of questions every session. Through the years, I changed the centers and the therapists. And now I'm ready to share with you my important observations. First, please look into our Early Steps program. The name of the program varies from state to state. It also calls Early Childhood Intervention Program. This program provides therapy services to infants and toddlers from birth to 3 years old with developmental delays or a condition that may result in a developmental delay in the future. I highly recommend to take advantage of this program as you can get help from ITDS, Infant Toddler Developmental Specialist, who may come to your home once or twice a week and work with your child towards hitting milestones. It includes activities for speech development, fine and gross motor skills. I really like this program as they not just provide direct help to child, but also they educate parents and caregivers how to be proactive and include age-appropriate activities in the daily routine. Now let's talk about therapy centers. I think it can be divided into 3 categories. Companies that provide services at home, private centers, and big hospital outpatient rehab centers. I will call them just big centers. So I want to focus on the last 2, private center versus big center. Number 1 is cleaning procedures. I found that big centers have to follow strict hospital regulations that obligate them to sanitize everything, literally everything. So they sanitize even toys after every session. In the private centers, they do their best. They ask kids to wash hands, sometimes to take off their shoes, but they don't sanitize toys after every session. Number 2 is equipment. Big outpatient centers, they're fully equipped. They have fancy gyms for physical therapy, sensory rooms for occupational therapy, and really nice rooms for speech therapy that are equipped with the special window who allows parent who sits outside to see the session. But at the same time, child who sits inside with the therapist cannot see the parent. In the private centers, they have less equipment and they have smaller gyms, but sometimes they have much more interesting toys rather than standard toys in the big facilities. Number 3 is insurance. Big centers, they accept most of the insurances. Rather than private centers, they accept limited number of insurances and of course they welcome self-pay. Number 4 is choice. Yes, you heard me right, it's choice. In the big outpatient centers, usually you cannot choose the therapist. They will assign the first available specialist to see your child on a permanent basis. In the private centers, if you want, you can choose the therapist. Number 5 is reception. So if you have questions to billing or insurance department or maybe scheduler, so you will have to go and find and talk to 3 or 4 different people until you find the right one, as they have there, every employee is responsible for something specific. In the private centers, you'll probably have 1 or 2 people who are responsible for everything besides the therapy itself. And number 6, finally, is location. Very important factor to have in mind, as if you need to drive 30 minutes every way 4 times a week, you will get exhausted really quick, and it will be hard to your child as well. So it's a better chance you will find private center close by rather than a big outpatient center. As you see, there are a lot of components to take into consideration. For bigger kids who are at school, there is also option to get into IEP program that provides therapists at school. All the links and important information you can find down below in the description. And please let me know in the comments if your child is already getting therapies, speech, occupational or physical therapy, or maybe different kind of therapy, and you see the results so far. If you enjoyed today's content, please give me the thumbs up and subscribe to my channel. See you soon. Bye bye.